Hi there, you're welcome to Demi RX Care channel where we talk about medications and how to use them properly. If this is your first time on our channel, make sure you hit the like and subscribe button down below. That way you can get alerts anytime we post our other educating videos and content here on our YouTube channel. All right, so let's go ahead and dive right into our topic of choice today. So our medication of choice today is known as Welchol. So Welchol is also known as a generic name called Colesevelam. So this medication is used for patients who have a high cholesterol, and it can also be used for treatment in patients who have a type 2 diabetes. And most especially if the patient does have high cholesterol as well as type 2 diabetes, this medication can be highly beneficial since the medication helps in treating both. So let's talk about the dose of this medication. So the medication is usually taken as a 3.75 gram tablet daily. So this is usually taken in divided daily doses. So it's divided all throughout the day, including your meals and liquids. So you want to take it with meal as well as liquid and kind of divide it between your breakfast, lunch, or dinner, or however many meals that you take in a day. So this medication comes in a 625 milligram tablet as well as a 3.75 milligram suspension. So what are some side effects to look out for while you're taking this medication? So side effects include nausea. This medication can also cause constipation as well as abdominal pain. It can cause cramping, bloating, gas, indigestion, as well as a throat obstruction in some patients. This medication can also cause headache and fatigue as well. So keep in mind that this is not a all-inclusive, you get one, you get all the side effects. So just in case if you notice one of those side effects, these are things to mention or bring up during your next doctor visit. That way they can find out if this is actually something that's favorable or prescribe something else if this medication side effect is unfavorable to you. So what are some serious side effects that you definitely want to reach out to your doctor for immediately when you start feeling those symptoms? So a serious side effect of this medication will be a sudden or severe stomach pain. Also, if you start noticing a consistent nausea and vomiting, as well as a consistent constipation. Also, in patients who have a yellow skin or yellow eyes, this might be a condition that's due to like a liver issue or a pancreas issue. So this might be a condition that's due to a liver issue or a pancreas issue. So you definitely want to bring that up immediately when you start feeling those side effects, as well as swallowing, weakness, confusion. These are also common side effects that can happen and are serious, in which you need to reach out to your doctor immediately when you start feeling those symptoms. So what are contraindication, meaning who are the patients that cannot take this medication? So patients who have a history of bowel obstruction, this is not a favorable medication to take. As I said earlier, this medication can cause constipation, so you don't want to take this medication if you have a history of bowel obstruction. Also, this medication can cause, this medication should not be used in patients who have a history of hypertriglyceridemia induced pancreatitis. I know it sounds like a mouthful, but if you have a previous pancreatitis or issue with your pancreas, in the past, or if you have a history of a high triglyceride, then you don't want to take this medication, as this medication can increase your triglycerides level. So it's not favorable in those patients. So what are things that you need to know or points that you need to take with you as you're taking this medication for your daily use? So first of all, if you are taking the powder packet, then you want to make sure that you empty one packet into a glass and add about 4 to 8 ounces of water or fruit juice or a diet self drink and mix it very well before taking this medication. You don't want to take this powder by itself and swallow it. This is a no-no. So you want to make sure that you're diluting it with the liquid that I mentioned earlier in order for it to be able to work as effectively and safely as it should. Also, with this medication, in patients who are taking a medication called metformin extended release, especially in our patients who have diabetes, this medication called Welchol, as I mentioned earlier that we're talking about, can increase the metformin concentration. So you want to make sure that you're, reminding your doctor to take caution due to the dose of metformin, because there's actually a maximum dose of metformin that the patient should be taking in order to avoid side effects. So usually the maximum dose is about 2,000 to 2,500 milligrams. So if you're already taking a maximum dose of about 2,500 milligrams, adding a Welchol can increase that level of metformin extended release in your body and cause an increased side effects. So that's why we don't want you to be taking a higher dose of the metformin already. So this medication, Welchol, can also decrease the absorption of certain vitamins that we take regularly, such as our fat-soluble vitamins, which is the vitamin A, vitamin D, vitamin E, as well as vitamin K. So in patients who are taking this fat-soluble vitamins, this medication can decrease the absorption. So you want to make sure that you're separating it by 4 hours. So you want to take those vitamins at least 4 hours before you take Welchol. Also, in patients who are taking folate or folic acid as well as iron, you want to make sure that you're separating it, like I said, at least 4 hours before you take the Welchol medication. Also, like I said earlier, you don't want to take this oral powder by itself. You want to make sure that you're mixing it with liquid into a liquid suspension before drinking this medication. Also, with Welchol, this may be an option in patients who are pregnant, as this doesn't really pose a great risk on the fetus. So usually in patients, they've noticed that the fetus risk regarding Welchol is very minimal. So this might be an option for patients who have diabetes or high cholesterol. Also, it's very important to make sure that you're eating regular meals that's going to help promote bowel movement, because like I said earlier, this medication can cause constipation. So you don't want to eat diet that are full of foods that's going to increase that constipation risk. So you want to make sure that you're eating like a fiber nutritious diet that's going to help you go. Also, this medication in patients who are taking birth control, you want to make sure that you're taking your birth control at least 4 hours before taking Welchol, as this medication can interact with your birth control. All right, so I hope I was able to let you in on all the tips that you need to know regarding how to take this medication successfully and safely while you're treating whatever condition that this medication is prescribed to you for. If you haven't yet done so, make sure you hit the like and subscribe button down below. That way you can help support our community here at Demi RX Care, and also get alerts anytime we post our other educating videos and content here on our YouTube channel. Thank you for watching and stay blessed.